Welcome. Thank you for participating in the first Neuromuscular Fellowship Fair. We're excited to host this, hoping it'll go over really well so that we can get some additional people interested for next year. Question and answer we'll have at the end of the session again. We will utilize the chat session, so you are welcome to submit a question at any time, but we won't be answering those questions until the end. So we will hopefully have about 15-20 minutes that we can just have some conversations. And Dr. Peltier, we'll let you go ahead and start off.
So I'd like to say hello to everybody and hello and welcome from Nashville, Tennessee. So I am Amanda Peltier. I'm the program director for the Neuromuscular Fellowship at Vanderbilt University Medical Center. And like I said, we are in Nashville, Tennessee. Vanderbilt is actually the largest academic medical program in the state of Tennessee. And we see patients from quite a huge geographic area. So Kentucky, Alabama, Indiana, Georgia, and many other states. So we have been around for quite a while. We obviously existed like many programs did as a neurophysiology program for many years. And then when ACGME approved the Neuromuscular Fellowship Program, we were in that first group of programs to be certified. We have 5 adult neuromuscular faculty. We have 1 pediatric neuromuscular faculty and 2 advanced practice providers in our group. The department at neurology at Vanderbilt is about 100 providers at the moment. We also have a Muscular Dystrophy Association clinic and an ALS multidisciplinary clinic that's funded by MDA. And we are also a Guillain-Barré Syndrome CIDP Center of Excellence and a Pediatric Center of Excellence for Spinal Muscular Atrophy. We also see patients at the Nashville Veterans Administration Medical Center, and one of our providers is full-time there. We also have a multidisciplinary amyloid clinic, as well as autonomic clinics at Vanderbilt. So as far as training, we make sure all of our fellows are proficient in neuroconduction studies, repetitive nerve stimulation, electromyography, single fiber electromyography. All of our fellows get excellent training in outpatient and inpatient care of neuromuscular and autonomic disorders. We also have biopsy conferences and go over muscle biopsies. We do have nerve biopsies, but they are relatively far and few between anymore with more technology. So we do them, but I did not include them on this slide. And we also do a fair number of skin biopsies as well. And we have a full autonomic lab at Vanderbilt. And we're actually one of the oldest, actually the oldest autonomic center in the country. And so we offer a fairly large autonomic program as well. And our fellows have 2 templated clinics in which they see their own patients, and they are responsible for patient phone calls and follow-up of those patients, as well as attending to additional neuromuscular clinics during the week with faculty. And then they spend 5 half days in EMG and then have a half day of reading time. We have also offered fellows opportunity to do additional training in either autonomic testing, Botox. We have had fellows who spent majority of their time in clinical research. So we have several other opportunities available for those fellows who want to. Because we are mainly Monday through Friday, some of our fellows have opted to moonlight. So that is something that's available to fellows as well. And then as far as Nashville, we have about 670,000 people in metropolitan Nashville, about 1 million if you include all the suburbs. And we, of course, are known as Music City since we are a major center for the music industry. And you will see lots of musicians in many stripes in Nashville. We also have the nickname of being the Athens of the South due to the large number of colleges and universities. And I would say it is one of the friendliest cities out there. And a lot of people enjoy living in Nashville proper. So thank you very much.
Thank you. All right, looks like we have University of Mississippi next. Dr. Shukla, you want to take it over?
A very good evening to all of you from here in Jackson, Mississippi. I'm Saurabh Shukla. I'm the Program Director of Neuromuscular Fellowship here. And our goal here is to chase excellence with lots of enthusiasm. Now, the highlights of our program, this is very friendly, supportive, very comprehensive, and we have one ACGME accredited position. I made the small presentation so I could tell you guys about our faculty, our mentorship, our clinical training, our locations, the didactic curriculum, a little bit about research opportunities, clinical trials, and some miscellaneous information here. So core neuromuscular faculty, it's three of us, me, Saurabh Shukla, Amanda Witt, and Dr. Tiffany Pikely. We have a mix of faculty who are trained in PMNR and neurology. So we have a mixed background. We also have faculties trained in single fiber EMG and autonomic lab. So that makes us a good comprehensive group. We have advanced practice provider also. We have been mentoring fellows and residents to present papers in regional and national conferences and bringing up a lot of interesting research projects. Just some data from last year, we presented at the AAN, AANEM, Carol Cruzen, also this year, and the ANA with a mix of both live podium presentations and posters. Our faculty here are national committee members for AANEM and ANA, and actually are a very good resource for early career development for fellows. Some of us are also reviewers for Neurology Journal and Nerve and Muscle. So we act as a good resource towards publications. And as I said, we have diverse backgrounds from PMNR and neurology, and a good peer support group, which is also helpful for future job search for the fellows. When it comes to clinical training, we are the only academic university hospital in the entire state. So you could imagine the amount of challenging pathology we would be getting and the geographic area that we would be covering. So we see all kinds of pathologies in nerve, muscle, neuromuscular junction. You say it and we have it here. We have brand new clinics in the River Chase neurology area, which just started last year. Very efficient, superb time flow. We have weekly MDA clinics and a monthly ALS clinic. We have the EMG lab and the autonomics lab in the university hospital, like right next to the ICU and the neurology floor. And we plan to bring in neuromuscular ultrasound capabilities very soon. This is a photograph of our River Chase Neuroscience Clinic. This just started last year, early January. So it's been 1 year and very efficient workflow and superb support staff. You would have various other subspecialties in the same area. There are bi-weekly resident clinics, and me and a lot of other neuromuscular faculty supervise them. So this is a great opportunity for fellows for clinical teaching. Tele video conferencing is available. We see patients on tele now with the pandemic, so it's very well equipped, both technology wise and workflow wise. This is our Jackson Medical Mall location for the MDA clinics and the ALS clinics. A typical multidisciplinary setup where you have PT, OT, speech and swallow, nutrition pathology, all of us working together in a team. And this is actually a site for our MDA project, some of ALS research projects going on, all happen here in the Jackson Medical Mall area. This is a picture of our EMG lab and our little office around there. So we have 3 fully staffed NCS EMG suites, and we just got 3 brand new machines late last year, Natus and Viking software. And we do approximately 1,500 nerve conductions EMG in 1 year. That's the data from last year. And we have a dedicated technologist team. We have 5 to 6 technologists. 3 of them are on the EEG side and 3 of them are always on the EMG side. So you have a lot of support for nerve conduction studies. When it comes to autonomics, in the last 4 months, I was looking at the data and we reported almost a little over 50 autonomic studies in the last 4 months of 2020. We have opportunities for Botox clinics as electives, punch skin biopsy training, intraoperative nerve conduction studies, and we also support our electives. This being the only university hospital, there are a lot of other affiliated faculty in the state who are also interested, who can offer you a little bit of a private practice model. So we also encourage outside electives if you want to. When it comes to didactics, we have a weekly Mississippi Neuromuscular Friday conference, and I precept those. You could have an interesting case, an interesting EMG. We often do neuropathology lectures and share slide images, and also do journal clubs on Friday mornings. We do a small group discussion on Tuesday afternoons. There are neuromuscular didactics for residents, which could be great teaching opportunity for fellows. This could be, recurring monthly lecture or an entire month block of neuromuscular training. And here we have great morning reports from the inpatient team, and sometimes we have great, interesting neuromuscular cases there. There are tons of teaching opportunity for fellows. You have the neuromuscular resident lecture series. We have med students in clinics and EMG lab. There are small group discussions with the M2 and the M3 class. There are grand rounds and the neuropathology conferences, as I was just mentioning. Being the only university hospital in state, we are a site for several clinical trials in neurology. And this includes both investigator-initiated and industry research. And I'm the PI for some of those. And Dr. Amanda Witt is PI for some. Dr. Tiffany Pikely has joined as co-PI. As I said, we are the regional site for MDA and ALS clinics. We have a great neuromuscular library, and we also collaborate with other departments for shared projects. So if you want to develop case reports, case series, retrospective trials, prospective projects, or you want to be part of ongoing clinical trials, we have it all going on here. There are some other perks being in this program. You get a PG Wi-Fi level stipend of around $57,000, which is pretty decent for this area. You get professional development funds. You have your own fellow office with your workstation, which is very close to my office. There are neuromuscular fellows, so you don't have weekend calls. You're free to moonlight. You get 3 weeks of personal leave every year. You get paid time off for conferences. You get 2 lab coats. And you have covered garage parking. You have great rental options nearby. If you're planning to be here a short time, there are some great restaurants here. When I moved here, I didn't have a car, so Uber and Lyft are readily available. And it's an easy driving commute, great grocery stores. And Jackson has good direct air connectivity to a lot of bigger cities in this part of the country. And some great entertainment avenues for families, parks, zoos, museums, public library, etc. So this is a short presentation about our program, and I end with a picture of a place that I really love visiting. That's the Rose Barnett Reservoir. And I'm open for any questions later on.
Thank you, Dr. Shukla. All right, Dr. Nozaki, are you ready to take it over?
Sure. Do you see the screen change?
Yes, we can.
Good. Hi, everybody. My name is Ken Ozaki. I'm the director of the Neuromuscular Fellowship at UAB. Using the next 10 minutes, I am going to introduce our fellowship. So for the people who is not familiar with the geographic area, UAB is located in Birmingham, Alabama, in the north central of Alabama. We have a great catchment area, not only entire Alabama, but also northern part of Florida and surrounding states, including Mississippi, Georgia, and Tennessee. This allows us to see various types of neuromuscular patients, in which fellows not a few times see a very rare conditions. So the UAB has relatively strong neurology department in this area. We have more than 70 clinical faculty members, and we have more than 40 trainees, including neurology residents and clinical fellows. We have comprehensive neurology services covering all neurology subspecialties, which makes us to focus on neuromuscular medicine and EMG. We also have busy neurology admission consultation services. Although we do not provide direct inpatient neuromuscular consultation, we do EMG for the admission patients. And I usually ask my fellows to get information and contact the treating team and also the participating in the patient care. So they will also learn acute, develop, and also quite severely injured patients. UAB has 4 facilities. UAB Medical Center is a flagship hospital. Also, we are deeply involved in VA Medical Center. We send fellows to the Children's Hospital or MDA. A fellow also supervise resident in Cooper Green Hospital. It's only limited times. So we have this allows fellows to see a diversity of the patient populations. So this is a neuromuscular service. Neuromuscular division covers a very broad area. In clinic, we see all types of neuromuscular conditions, including nerve, muscle, and motor neuron disease and autonomic. We have adult and pediatric separate MDA clinic, and also we have ARS clinic at VA and UAB Medical Center. In terms of electronic studies, in addition to routine nerve study EMG, we provide single fiber EMG and evoked potentials. One of the strengths of our fellowship is that we have all neuromuscular biopsy suite in neuromuscular pathology lab. We see muscle, peripheral nerve, and skin for small fiber neuropathy. So we also accept specimens from outside facilities. Total number is approximately 350 to 400 cases per year. So this is led by 3 neuromuscular attending, not neuropathologists. So the fellows have great access to the pathology. Over the last couple of years, we also launched autonomic test services, covering autonomic reflex screen test and TSP, which allows us to provide a great care for the people who suffer from autonomic disorders. This is the teaching faculty. We have 6 adult and 1 pediatric teaching faculty members. Interestingly, all members have different training background. So even if I have questions, not a few times I don't have to consult outside a facility. Some of the members know something. So this will allow fellows to learn from many interpretations. So I'm going to talk about training for the neuromuscular and EMG. We have a long and great tradition of training neuromuscular and EMG. Dr. O is a nationally and internationally well-known neuromuscular specialist. He's launched neuromuscular service in early 1970s. Over the last 50 years, we are proud of training almost 120. I counted yesterday, almost 120 trainees, international, national. So this is a guideline for the fellowship. Our fellowship, so that historically, we used to have a neuromuscular and clinical neurophysiology fellowship. We combined a neuromuscular, we combined clinical neurophysiology fellowship EMG track into one neuromuscular fellowship. So this is ACGMA accredited 1-year fellowship. We accept definitely 2 fellows per year. If the funding allows, we may accept additional, so total 3. Apparently, our mission is to develop and educate neuromuscular specialists competent in evaluation care of neuromuscular disorders and at-risk studies. So the following is a guide composition of on-site training. We do not do the block system, but we combine EMG and clinics in the good ratio. So there are not a few times residents ask, and also whether they need to do the neuromuscular and EMG clinical neurophysiology too. As you see this number, although this is a neuromuscular fellowship, we have a fair number of exposure to EMG studies. And after the fellowship, they do not feel they have to earn additional clinical neurophysiology fellowship. So going back, so that we have 2 to 3 neuromuscular clinics. In addition, we have MDA, adult and pediatric, and AOS at UAB and VA hospital. EMG fellows will work 4 to 5 half days per week. So this is our strength. We have, as I talked to you, we have our own pathology lab. So the fellows will have 1 half day to review the pathology by themselves and have opportunity to learn, review with faculty members. I do this core curriculum for the first 6 months and meet each fellow. If the fellow reaches a good level, I allow them to go to the advanced technique, such as single fiber EMG, biopsies, and autonomic tests. So regarding direct lectures, we have neuromuscular EMG lecture series every week. I start from a core curriculum, spending 2 months of focusing on reviewing of the neuromuscular pathology and fundamental of principles of EMG and nerve study. Then we spend 4 months of basic neuromuscular disorders and EMG techniques and pathology. And for the last 6 months, we do more advanced conditions, which allow them to see patients independently after graduation. In addition to pathology review with attending, we have separate direct lectures for the pathology review session every week, spending 1 hour. So starting from review of a basic muscle nerve skin biopsy interpretation, then during the last 6 months, a fellow will be asked how to interpret. So they also have teaching opportunity. We have 3 months rotation, 3 months mandatory rotation for PGY3 neurology resident into our service. We ask fellows to review neuromuscular pathology and fundamental of the EMG to PGY3 residents when they come to our service. We also assist examining the patients. I also ask neuromuscular fellow to assist our attending for the neuromuscular morning report. They also supervise resident clinic. The volume is small. It's only weekly for the 1 to 2 months. But I definitely think this will help for them to teaching after graduation. So although our program is clinically oriented program, we encourage residents to the research. We have ample and diverse clinical data. As I talked to you, we have neuromuscular pathology. I checked yesterday. We have, I did not know that. We have slides and reports since 1970. So over 50 years, we have collection. And also our department is very supportive for the fellows and resident research. So for the application, we need CV, personal statement, 3-year of reference, and we also have our own application form. For further information, please contact me or Sandy Murphy. I'm not familiar with the system, but through the ACGME portfolio. Thank you.
Well, we appreciate your time and those presentations. That's very helpful information. So we're going to move into the question and answer period. Since you have a chance to ask some questions. Dr. Morena has a question out there. So if you guys want to open your chat.
So, and Dr. Malatesta, our fellow, actually, I asked to join us as well. And so we don't currently have neuromuscular ultrasound. We are currently working on recruiting a faculty member who could bring ultrasound to us, but that's not something we offer at the moment. So we're hoping to have that in the next year or so.
Yes, so we were just joined by a new faculty, Dr. Tiffany Pikely, who's ultrasound trained. So she joined us in September last year, 2020. And we are in advanced stages of getting a neuromuscular ultrasound machine. So it should be with us sometime this year. So certainly will be there by the time 2022 fellowship year starts. So we do have a faculty who's trained in neuromuscular ultrasound.
Yes, currently we are not providing this service, but actually we have one attending who has experience in this procedure. So this is under discussion.
Okay, thank you. We're kind of waiting for some other questions to come in. One of the questions that Sherlyn was asking, the executive director, is Dr. Shukla, Peltier, and Ozaki, if you could comment on what drew you to neuromuscular medicine. Why did you choose that over some other specialty? Dr. Peltier, we'll start with you.
Well, for me personally, I think it was partly exposure. One of the very first patients I took care of as a medical student was a patient with ALS. But I think the thing that really drew me to neuromuscular was that I felt like we really used our physical exam skills more than any other area. And I always enjoyed the fact that EMG was essentially, as my advisor used to always say, Jim Albers, that it was an extension of your physical exam and you should never be surprised by what you find on the EMG. And so that was one of the things that I really enjoyed about it. And that and the mix of, patients that we saw was a strong factor for me. So.
Yes, so I feel neuromuscular subspecialty is like the zenith of localization and differential in neurology. That's something that drew me to neurology in the first instance. And when I was exposed to neuromuscular fellows and attendings, how they would examine patients, they would come up with differential based on time course, localization, and the age of the patient. So I felt, hey, this is the localization and differential. This is something super interesting. And in general, neurology residency trainings are not dedicated towards in-depth neuromuscular training. So towards the fourth year of my residency, I would feel a little incomplete as a neurologist without a neuromuscular fellowship. So that's one of the reasons I went for neuromuscular fellowship. It just makes me feel more complete as a neurologist, having a grasp of the peripheral nervous system.
I have PhD background, and I'm interested in correlation between inflammation and degeneration, and this is great. And actually, the second reason is that biopsy is relatively hard for the brain disease, but in our peripheral nervous system, it's relatively more accessible. And I was very interested in pathology, and that's another reason. The third, similar to Dr. Shukla, I'm interested in anatomy. And I was once told by one of the patients who is a car mechanic, and he told me that when I explained his lesion, he told me, "Doc, you can be a best mechanic." And this is a good quotation for me, actually. So this is a couple reasons for clinically and research-wise. I'm very interested in this area.
Thank you. Let's see, do we have any other questions out there that anybody wants to ask? I think from some of the other nights, questions we had heard is kind of what the workload is like.
I can say a little bit, and then if Lindsay wants to chime in. So our fellows, attending, we have MDA weekly, and so our fellow attends a weekly MDA clinic that alternates between our pediatric and our adult providers, and then all the other clinics. So Lindsay, I would say you're seeing what, 4 or 5 patients per clinic session with a mix of return and new patients, with mostly more new, hopefully.
Yes, I do see a lot of new patients, which is great. I do like that. Yeah, I get a very good mix between VUMC and the VA. Sorry if you hear my dog down here wrestling. I tried to put the camera up higher. And so I do get a couple of half days at the VA, as well as a few half days of EMG. I think the workload is a good mix. It's just enough to keep me busy, but I still have enough time, more so time than I did in fellowship, which is wonderful. I have time to do research and to plenty of time to read and to do the PowerPoints that I do each week, which is part of our reading presentations, which has been wonderful. And I get a lot of one-on-one time with the attendings. And on top of that, I get a lot of time, which is what drew me to Vanderbilt. I get a lot of time in the EMG lab, and I have kept logs of how many EMGs I've done thus far. And even with COVID and the numbers kind of declining, I've still been able to manage so far about 160 EMGs, and I'm only, a little bit more than halfway. So I think it's a really good mix. I don't think that there's anything that I would say I have a lot of time to slack off. I just got done working out, so yay, I have time to be a person. But I do have a lot of time in the lab and in the clinic. So I think it's a really great mix here.
That's wonderful.
I can go. Okay, so as I talked to you, we don't have inpatient service. And I believe our service is Monday through Friday, 8 to 5. Most of the time, our fellows can finish their job 5 p.m. or before. And I see Dr. Cori Schwartz, she's my fellow, and she can claim if I'm telling right. But in her case, interestingly, she's very dedicated for research. And I think she can, she uses her own time and also her research time to do her own research. But I also want to, could you provide more information, actual experience, ongoing experience, Corey?
Sure. Hi, everybody. I love our fellowship. I think it's a really wonderful mix. With COVID, the numbers have definitely gone down, but we have a good mix. Some attendings that are still seeing most of their patients in person. On occasion, something happens and someone's by video. Other attendings are all via videos, and others that are kind of a mix. And I did residency here too, and so I always hung out in the neuromuscular clinics on other rotations. So I see a difference in the volume, but it's been really wonderful that you have a little more time that you can talk about things with COVID going on, because the volume is actually quite high. And so I've enjoyed this year having it a little slower. I won't be as fast next year, probably because I'm not used to practicing being as fast, because it is a little more relaxed, but it's been great to kind of wrap your head around what's going on. But even when it is busy, people are always willing to stay late, answer questions, go through things after the fact, whether it's that day or the following day. Sometimes the attendings will pop in and just check on us and see that we're doing okay. Do you have any questions? Is there anything you want to review? Or we'll go seek out some of the attendings later and say, can we go back and review this? And everybody's so wonderful and helpful. And the volume through the EMG labs has remained steady, which is great. Lots of cancellations at times, but other days we're pretty slammed. And so you get more than enough exposure, lots of good cases, lots of inpatient cases. And then even the times we feel like there's more to be desired about learning what's going on with the inpatient service. If we want to, we just run up to the floor and examine them again, talk to the team. So although not like a formal consult service, if there's interesting cases, and there are a lot, we definitely have the opportunity to go up there and have the time to do it, if that's what we want to do and kind of pursue the case and see it through. We also get to see a lot of people at follow-up, and there seems to be great continuity with seeing people in clinic and EMG, which is wonderful. So, and then we have time to read pathology, a little free time to study as well. I got back into working out this year, so that was good, enough time to do that. And on my weekends, I choose to come in a lot to go through the pathology, because like Dr. Ozaki, I'm very interested in the pathology. But it's kind of on my time, which is nice. It's not mandatory. No one expects it at all, but I've really enjoyed it. So lots of opportunities. Also, they're really good with reaching out if we want to do case reports and kind of look into doing research, retrospective case reviews. And so somebody's always available to be supportive. Okay, I'll stop talking.
I can go next.
Sounds great.
So we have a pretty flexible program here. You know, we want you fellows to reach your ACGME goals. We typically have clinics starting at 8 in the morning. The first session ends at noon, and then the second session starts at 1, ends at around 4:30. A mix of new and old patients. And, you know, as you know, this is the only academic center in the state, so you get all kinds of interesting pathology. We have MDA clinics every week, and you know, all three of us, faculty and an advanced practice provider, is there. So, you know, based on how early or mid or late you are in your fellowship, we can always be flexible in terms of the patient volume, and we have enough support staff who can see patients directly. And that holds true for the EMG lab as well. You know, having trained technologists, my plan is to typically have more interesting EMGs for the fellows, and you know, sort of more common ones for the technologists to take over. Certainly this would be different in the earlier part of fellowship. So flexibility is our motto here. And the nerve conduction EMG lab is right next to the ICU and the floor. So, you know, that's a great area for inpatient consults or inpatient EMG studies. We also aim to have at least, you know, 1 to 2 half days for fellows to do readings, prepare for our weekly conferences, didactics. So as I said, flexibility is our motto, and we'll make sure that you reach your ACGME goals. And we work with you periodically to, you know, either shift more towards the EMG side or the clinic side. You know, what is your interest? So periodically assessing your progress and then deciding your work balance and you know, research or clinical interest balance based on that is our goal.
Thank you very much. Okay, well, it looks like we do have another question out there. Do anybody want to answer that?
So this is Amanda Peltier. I'll answer it since I brought it up. So when our fellows have done moonlighting, they've done general neurology service. We also have an option at Vanderbilt to do a teleneurology service, in which they essentially are acting as a consult service for some of the smaller rural hospitals in Tennessee that Vanderbilt has contracts with. And so one of our fellows did that as well as part of the, you know, on the weekends when they were a fellow. So those are the major opportunities that we've had. Not every fellow has wanted to do that, but those are the opportunities we've had for our fellows who've chosen to do it.
Thank you. Dr. Shukla, I think you mentioned moonlighting too. Do you have anything to add?
So ours would be in general neurology, not the neuro ICU. You know, we are adequately staffed right now, but, you know, if we have a fellow who's interested in precepting the general service, you know, we would be interested if you are board certified and if you are interested, but this would not be for the ICU.
Thank you.
I'm Ken Ozaki. I'm from UAB. I need to double check this, but not a few times, sometimes actually, when inpatient service is busy, they are recruiting for somebody to back up. So I think there's a probability. But if anybody has any question, I'm happy to discuss as an interview.
Okay, thank you very much. Any other questions out there? Okay, well, I think we will go ahead and wrap it up then. As always, thank you everybody for participating. We appreciate you taking the time to introduce your programs and share a little bit about it. Residents, fellows, we appreciate your time as well. Remember that, you know, obviously you may come up with questions after this. So you do have the advantage of the portal where you can directly send communication to the program. So feel free to utilize that tool. Again, in the future, we hope to have a live annual meeting this year, which we missed this year. We also have a spring meeting that they just sent out notification on, so feel free to check that out. Have a wonderful night, everybody.